Hi everyone. I welcome you all in another informative video. In this video, we'll see how abnormality looks like, and why psychologists ask for your brief medical history when they have nothing to do with it. Why they ask for you past, from the day you born to till date. What are the medical tests for abnormality? So, quickly let's jump right into the video. In this era of rapid technological advancement and development, you might think that there would be some objective tests, some physical tests, or some sort of medical tests like CT scan, ECG, or a blood test, etc. That could help you to confirm that you're suffering from some sort of mental disorder. But, let me clear it that, there's no such test available for diagnosing abnormality and normality. We do have some objective and subjective tests like thematic apperception test, Rorschach's test, intelligence test, personality test, IQ test, etc. But, we use them once the abnormality is confirmed. Then, how we psychologists came to know either a person is normal or abnormal. Well, psychologists have a general criteria of abnormality that lately, we'll discuss in this video. So, we have some general criteria of abnormality and specific criterias for mental disorders. First, let's see the general criteria. 1. Violation of social norms. Person will deviate his social norms. Now always consider the socio-cultural factors. Maybe, one thing is acceptable in one cultural, that is unacceptable in other cultural. For example, drinking alcohol is common in many countries but it's considered as illegal in others. 2. Distressing. Person will stress out himself, due to socially unacceptable behaviors. Or due to the consequences of those behaviors. We'll see it through an example, later. 3. Dysfunction. Person will be unable to do his everyday activities. Like he will quit his job, quit the productive activities and meaningful life and will isolate himself in a room. Because, it makes him satisfy. He won't to come out of his comfort zone. Next and lastly we have danger. Abnormality can make a person dangerous. Because, he can harm himself as well as others around him. Suppose there's a person named Sam. And he's suffering from trichotillomania. Trichotillomania is a sort of psychological disorder, in which, person pulls out his hair either from the head, from the body, eyebrows hair or eyelash hair. And it ends up in bald patches in head and decrease in eyebrow hair and eyelash hair. Sam can resist himself to stop. Because, it makes him anxious, and stresses him out. And, due to the baldness, he cannot go outside of his home, and do his job. Because people will mock off him. It leads him to inferiority complex, because he thinks that he not good looking and his hair will take long time to grow back. Now, he started to feel hopeless, helpless because neither he can stop himself from pulling hair out and nor he can make them grow back. He started to feel like, now there's nothing to do in his life. All these things, collectively can end up in suicidal thoughts. Now moving back to our criteria. 1. Pulling hair is socially unacceptable behavior. Right. 2. Consequences of this behavior is baldness, that's stressing him out. Right. 3. Due to inferiority complex, he quit his job, so he's becoming dysfunctional. Right. Lastly, suicidal thoughts are dangerous for him. That's how abnormality looks like. Now, how can we know that we should consult a psychologist or psychiatrist now? Physical aches are quite easy to notice. But how can we know we are suffering from mental illness, or some initial stages of mental disorders? So, there's a brief explanation of when you need to visit a psychologist. When you've lost something and cannot get over of its loss. When your child is misbehaving. When you are experiencing sudden weight gain or weight loss. When you're stressed. When you're feeling fear of something. When you're suffering from relationship conflicts like you're unhappy with your spouse, conflicts between siblings, friends, teachers, etc. When you become used to of bad habits like stealing, substance use, masturbation, pornography, excessive eating, bullying, screen addiction, etc. When someone is harassing you, abusing you or assaulting you. When you or your loved ones are diagnosed with some lethal diseases. It makes them mentally disturbed. When you have some terrible past events, traumas, that's affecting your present. That's it for you guys. Now in the next video, I'll briefly explain you what are the causes of these abnormal behaviors.